Welcome to a lesson on first aid. Upon completion of this lesson, learners will be able to describe and understand the importance of first aid, the benefits of knowing first aid, and information about first response procedures. Learners will also be able to recognize appropriate first aid response procedures. First aid is the immediate care given to an injured or ill person to stabilize their condition before professional medical help arrives. Industrial jobs involve the risk of injury, and first aid is one of the best ways to reduce the likelihood of death or permanent health problems resulting from these injuries. First aid is also important knowledge to have outside of the workplace. First aid is defined as a procedure that provides initial care to someone who is ill or injured. It generally consists of a series of simple and, in some cases, potentially life-saving techniques that an individual can be trained to perform with minimal equipment. A safety and health manager is responsible for first aid stations in most industries. The medical kit and other emergency supplies are stored in a first aid station. Some plants even have a nurse who works at their facility. Workers should be aware of the locations of first aid stations, emergency showers, and eye wash stations. Emergency shower and eye wash stations can be utilized in emergencies like chemical spills. Both employers and employees must work together to understand first response procedures. A quick response can sometimes save the life of a coworker. If a worker is not trained to perform first response procedures, he should inform a supervisor about the incident, call 911, and ensure the area is safe for emergency personnel to enter. If possible, it is best to keep the injured person lying down, and if they are bleeding, pressure must be applied to the wound until emergency response personnel arrive. In some cases, cardiopulmonary resuscitation must be administered as part of a first response procedure. Cardiopulmonary resuscitation, better known as CPR, is a procedure performed to save the life of a person who has lost the rhythm of their heart. Only attempt to provide CPR if properly trained. The best CPR training for workers is available through their local American Heart Association, AHA, or American Red Cross chapter. If a worker gets exposed to hazardous materials, there are several measures they can take to minimize the risks to their health. The first and foremost thing is to contact a supervisor immediately to report a minor accident. If the skin is exposed to hazardous material, wash the affected area thoroughly with soap and water. Then inspect the exposed area for puncture wounds and burns. If exposure results in a puncture wound, the worker should ensure they have received appropriate tetanus vaccinations. In the case of minor burns due to exposure, the wound should be treated with cold water. If a person's eyes are exposed to hazardous material, flush the eyes with water for 15-20 minutes in an eye wash station. If workers inhale hazardous chemicals or materials by mistake, they should leave the environment immediately and move to an area with fresh, uncontaminated air until symptoms subside. In case of an ingestion exposure, consult the material safety data sheet for the exposed material, follow the exposure instructions listed, and then consult a doctor for further diagnosis. In summary, first aid is a procedure that provides initial care to someone who is ill or injured. It generally consists of a series of simple and, in some cases, potentially life-saving techniques such as CPR. Remember, though, that first aid can help save lives. You should always inform your supervisor and call 911 in case of a serious worker injury. Both employers and employees must work together to understand first response procedures. Thank you.